My name is David Levine. I'm a orthopedic surgeon here at Special Surgery. I have a practice focus, which is pretty much entirely foot and ankle surgery. We endeavor every day to try to manage people well at the early onset of their trauma, to try to make a joint, for example, smooth. We try to encourage them to participate very actively and aggressively in physical therapy to try to improve their range of motion. By improving their range of motion, pressures in the ankle joint or joint of the foot that's relevant will become less. Achieving a greater range of motion means less pressure in the process of walking and participating in the patient's activities of daily living or light recreation. We start with a standing examination just to check alignment of not just the ankle and foot, but how it relates to the knee and the hip and the spine. Their opposite leg plays an important role in what is required of the given side. And then from that perspective, proceed with an examination and try to understand the nature of this problem. I see a fair number of trauma to the foot and ankle, so ankle fractures, Achilles tendon ruptures, calcaneus fractures, which are heel fractures, fractures of the midfoot called Lisfranc injuries, and metatarsal fractures, amongst other things. Simpler things like ankle sprains, for example, and its resultant ankle instability is a common problem that we see. In the non-traumatic or the chronic side of things, take care of a lot of patients with bunions, with flat feet, with tendon insufficiencies like chronic Achilles tendonitis, or what we call, it's a fancy term, posterior tibial tendon insufficiency, or the adult acquired flat foot, very common thing that we see. So it runs the gamut of things from an acute traumatic circumstance to those that are more chronic and insidious in onset. Seeing a patient recover function, walk in, getting a sense that their life has been restored is really the greatest privilege. And you know, it's interesting, I was talking with my wife, I think it was one afternoon where maybe work was a little challenging in a given day, and she said, you know, you really are a lucky person. You make such tremendous effect in patients' lives on a daily basis. And I kind of made me feel good because it's very true. We really take patients and put their lives back together for them.